welcome to our podcast channel around breast implant illness. We are the non-profit organization Krank durch Brustimplantate, Wir helfen e.V. in Germany. My name is Birgit Schäfers. I'm the founder and leader of the organization. Thanks for listening to us.
Hello again. Today our topic is lipofilling. And my guest today is Dr. Georgios Kolios from Hamburg. Hello, Dr. Kolios.
Hello, good morning.
Hey, nice to have you here again.
Thank you.
May I ask you to introduce yourself shortly to our audience?
Of course, thank you very much. I'm happy to be here again, and now we are translating these podcasts in English language and try to do as best as we can do.
Yes.
So, just about myself, I'm a plastic surgeon in Hamburg, specialized in reconstructive and aesthetic surgery. I work as a chief physician in a clinic, but also lead a large outpatient network focusing on the face, breast, and body contouring. What I want to mention is that I no longer use breast implants because I've seen too many different kind of complications over the years, and the patients are really affected about these complications. That's why I now use other safer and more natural techniques for breast and handbands. And one of these methods, I'm very happy that we will talk about them today. And again, thank you. I'm grateful for this invitation. I think it's very important to talk about these topics.
Yes, thank you so much. Okay, so Dr. Kolios, can you explain in simple terms what lipofilling is and how long you have been using it?
Lipofilling is a technique that has developed gradually since the end of World War II. I want to talk a little bit about the history of that. So originally, idea came from Germany, and surgeons wanted to fill contour defects using the patient's own fat tissue. But over the time, it didn't work so well, and then the Americans took it and evolved into what we now call lipofilling. In this procedure, fat is removed from one part of the body using gentle liposuctions. This fat is then purified and injected into another area that needs more volume, for example, like the breast or the face. And the nice thing about this operation procedure is that we only need tiny punctures in the skin to place the fat or take the fat out. And I like this because you use your own tissue, and it is a very natural and biocompatible method. And I'm using that since I was in the education of plastic surgery. So from the very first years, we are using that.
Okay. To be honest, I never knew before that it's also used in the face. That's quite interesting to me. Okay, so and what areas of the body is lipofilling suitable for? So you just talked about it. It's for breast and face. Are there any other?
Exactly, absolutely right. Most commonly, it's used in the breast or in the face. For the face, we need a little bit different procedure on the fat. So we need a smaller fat. We call it nano fat. And usually for the breast, we take micro fat. But you can use it generally for all kind of enhancement in the body. For example, like in the gluteal area, it's also used, and it was like a fashion trend to use it in the gluteal area. But this is a more dangerous procedure, and it needs a very tedious planning and performing. So it needs a lot of experience because the patient can die on the table. So lipofilling commonly is used to restore or increase volume in a very natural way. For example, the breast shape or the face can be slightly improved, but the main goal of lipofilling is volume enhancement, not reshaping. It can also help to correct mild asymmetries, for example, when one breast is smaller than the other. However, major shape differences cannot be fully corrected with lipofilling alone, but it depends on their symmetry. The method is also used in breast cancer patients after mastectomy, especially when smaller contour irregularities remain. How much fat can be injected depends mostly on the elasticity and the firmness of the skin. This is very important because if the skin or breast tissue is too tight and firm, only a limited amount of fat can be added. Otherwise, the pressure would be too high and the fat cells would not survive. If the skin, on the other side, is softer and slightly loose, more fat can be injected safely. As a result, the skin also becomes smoother and tighter because it is gently filled from the inside. And patients often ask, of course, how much larger the breast can become. And usually we can expect an increase of about 1 or 2 cup sizes per session. But the nice thing about this procedure is that we can repeat it after some time and a lot of times until we achieve the result we want. So even more volume can be placed after a while.
So, a new question to you, I think,
Okay.
is did you ever do that to a transgender? So, what about that skin? Is that different? Can you use it for that as well? Or do
Yeah,
you, yeah?
yeah. It just depends on the firmness and the skin elasticity. For example, it's not depending on the transgender patient. So it depends now when you, for example, having a man without any weight changes during time, the skin usually is tight.
Yeah.
So you would not you wouldn't have the best result with the first session. So, but if there is a man, for example, a transgender man who has a looser skin, you could add more fat and have a better result in the first place. So it
Okay.
just depends on the skin and
Okay.
on the how much size place you have.
Okay, I understand. Okay. So you just mentioned it. Is it possible to change the breast shape with lipofilling? For example, if the lower part of the breast has little volume?
Yeah,
Is that, yeah?
that really depends on the situations. So, for example, when we have both breasts affected, we call it a bilateral asymmetry. In such cases, of course, we can carefully adjust the contours by injecting more fat into certain areas or less into others. But, for example, we can add more fat to the lower part of the breast to create a fuller and more balanced shape. But if only maybe one breast is affected, we can also adjust the fat placement to correct the asymmetry. However, this is only possible, and this is very mandatory, if there is enough skin and enough tissue to allow for the new volume you add. So if too much tissue is missing or the skin is too tight, lipofilling may not be sufficient, and in those cases, we need to consider other reconstructive techniques.
Okay, I understand that. What about lipofilling and implant removal? Why don't you perform both procedures at the same time?
Yeah, that's a very good question, as some colleagues like to do that. But implant removal, especially when we do it as an en bloc capsulectomy, so where the entire implant and the capsule are removed together, is a very complex and time-consuming procedure. So it takes time and involves the use of several instruments, stretching and manipulate the breast tissue, the skin, and this naturally causes swelling and inflammation inside the breast. And because of that, I believe that doing lipofilling at the same time will reduce the fat survival rate. And there are two main reasons for that. First is that the swelling after implant removal increases the pressure inside the breast, which makes it harder for the new transplanted fat cells to connect to the blood supply. And by injecting, the pressure increases stronger. And secondarily, the healing environment is not yet stable. It's still reacting to the surgery. And that's why I prefer to do these procedures in two separate stages. And this allows the breast tissue after breast implant removal to heal and calm down first so that the fat grafting can integrate better afterwards and we have a better result. This is my belief.
Okay, I see. Can you say how many months you should wait, or is there just a roundabout or a time you have to wait?
Yeah. For in my opinion, it also depends on the situation. But for example, when you have a patient with very thin tissues and you would expect contracture and scarring, you would go to do lipofilling earlier. So, for example, you can see a post on our Instagram and showing these kind of conditions, and this patient is performed early after 6 to 8 weeks. But if there is no fear about scarring or contraction, you can take a longer time, like 3 months, for example.
Okay, thank you. So, and there's another important topic and also interesting about lipofilling and weight changes. So, which fit can be used, and what happens if someone gains or loses weight afterwards?
Very, very good question. We have that commonly. So generally, you can use any type of fat of the body, but I prefer to use deep depot fat, usually taken from the inner thighs. This is an area which allows a safe fat harvesting, even in patients who are quite slim. So some patients are told elsewhere that they are maybe too thin for lipofilling, but with the right technology and a gentle technique, it is often still possible to collect enough fat to make a visible difference in the breast volume. So it's often more possible than others who doesn't perform lipofilling often might know. So, yeah. And about the topic of gaining or losing weight, we need to know that fat cells are post-mitotic cells. This means they do not divide for increase. They only get bigger or smaller. So the amount of fat cells in the human body doesn't change during lifetime. In other words, a fat cell doesn't multiply. It simply stores more or less fat. When the transplanted fat cells successfully connect to the blood supply, for example, in the breast, they stay alive and remain in the new location, just like any other transplanted tissue. And at the donor site, those fat cells, of course, permanently are removed. So if a person loses weight, the fat cell shrinks and the breast may become slightly smaller. If they gain weight, the fat cell grows again and the breast volume increases. But there are some studies ongoing to study how the fat cells react when they become older in the body, and quite in the face there are some changes and might be differences, but we are very keen to see the results of these studies. So, summary, I want to say that the fat behaves just like the rest of your body fat. It changes naturally with your body over time.
Okay, I see. And if you have done a lipofilling, how long does the result last? Will that fat disappear again? And what can be done to improve the survival rate of the fat? I think that's a very important question.
Yeah, this is a very common question actually, and I heard that there are a lot of sites, Facebook and Instagram, they are talking about these, and but this is a very physiological question. So we need to know how transplant reacts, and it's important to understand that even though fat looks soft and fluid, it's actually consists of living cells. When we transplant fat, it behaves like any other tissue transplant. For example, when we transplant the skin, the cell grow in the new location and can live there permanently, and the skin then is integrated to the other skin around. So it's the same with the fat cells. If a fat cell successfully connects to the blood supply, it will survive and stay there for good. So there is no change anymore. However, why is the breast changing? Some of the liquid components, such as the tumescence fluid used during liposuction and the natural fluid from swelling or tissue fluid, are reabsorbed by the body in the first few weeks after surgery. So we have a big change from the day one after surgery until 3 months later. So this is why the breast often appears smaller again, and after some time of the surgery, this is completely normal. But if you compare pictures from before and after several times, you will always see improvement and change of the breast. And how important is the recovery time? I want to explain, and I usually call it the 3 times 7 rule. So the first 7 days are the most important ones. Each cell is fighting to connect to the blood supply, and many tiny new blood vessels start to grow into that fat. And then the second 7 days, so until day 14, it's called like a stabilization phase, where the new connections, the new blood connections strengthens and grow further. The third 7 days are about further healing and consolidation. So 3 weeks of rest, no exercise, no pressure on the breast, no stress, are extremely important for the final result. So depending on the technology used, the surgeon's technique, and how well the patient follow these healing recommendations, fat survival rates in the breast can range between 30 to 70%. This is a common rule, but in breast cancer patient it changes, of course, but we are now talking about the method of lipofilling in a normal woman without any disease in the breast. So, and the better all these factors work together, the higher the long-term result will be.
Okay. So now we come to a very important topic for us who all had breast implants before and didn't know about the risks. What about the risks and possible complications of lipofilling?
Yeah, and very good question. So commonly, whenever you have a procedure and a result, there is risks and there are complications. And we just need to know them, and we just need to explain them very well, that the patient can meet this expectation and can decide if he wants to do this procedure or not. So in lipofilling, we need to consider 2 areas. First one is the donor area. So it's maybe the leg where we take the fat from. And secondarily is the recipient area where we inject the fat, like, for example, the breast. And common issues from fat harvesting includes like slightly asymmetry between 2 sides. And then skin changes, like maybe small dense waves or streaks, especially in the thin patient. That's why the procedure must planned very carefully, using the right technique and the right cannula size, especially in slim patients. And here in the slim patient, the experience is very important to avoid these common problems, to try to avoid these common problems, better said. Concerning the fat survival phase, it is important to notice that not all fat cells survives. The ones that do not connect to the blood supply are naturally absorbed by the body. Interestingly, this process actually helps the remaining fat cells to integrate better, because by dying, these substances are released, and this supports the healing of the other cells. So by absorbing the fat, sometimes small oil cysts, which can be seen in the ultrasound as well, can occur. In rare cases, these cysts can calcify. So for the breast cancer screening, the patient should inform their gynecologist or radiologist that they had a lipofilling. And don't worry, experienced examiners can usually distinguish lipofilling changes from breast cancer very well.
Okay.
Yeah.
So back to breast cancer again. Does lipofilling increase breast cancer risk? Do you know something about that? Are there any studies or something?
Yeah, there are many studies, and we found that breast cancer risk is not enhanced. So studies showed that the fat grafting, or the concern was about the stem cells, that these do not increase breast cancer risk. And nowadays, also lipofilling is a safe and even standard procedure for breast cancer reconstruction following current guidelines. And just to mention, if the patient is afraid of these possibilities, you could do an MRI before and a few months after lipofilling. So you document the status before and after the surgery. And you can have these documentations when you go for breast cancer screening, but only a few patients usually do this.
Okay. Okay. So let's summarize it again. You just mentioned it, but to put it shortly, what are the key success factors for lipofilling?
For me, there are three main factors for good fat survival rate. First, that's the surgeon, his experience, and his used technique. Secondarily is the technology in this type of procedure and the equipment used. But third, and this is a very important factor, is patient's cooperation and the care after surgery. So commonly you can say the short operation time is very important. The time between fat harvesting and re-injecting should be as short as possible. The faster the fat is back in its natural environment with blood and oxygen, all of these factors, the better it will survive. So that's why the experience and the technique is important, not to harm, like the donor side or the recipient side, but also the technology which makes the surgery quick. And I'll talk about this a little bit later also. For example, additionally, I never perform this procedure on an outpatient base. Why? Because using local anesthesia for both the donor side and the recipient area can reduce the fat survival, and it's even toxic for cells. So we do it under anesthesia. So the experience of the surgeon is very important to adjust the different skin types and the fat deposits. And the careful planning and the use technique minimize the risks and optimize fat survival. So it's a very specialized, highly specialized procedure, even to say, even small differences in the technique can lead to different results. And that's why experience and attention to detail and the whole process is very essential.
Okay, so let's talk a bit more about that technical requirements. You just mentioned the cannula size, but there are other points that are important. So let's talk about that.
Absolutely right. I think that I was all over the world and was lucky to work with all the different technologies in lipofilling and liposuctions. And that's why I come to the conclusion that the equipment and technique which is used have a very big impact on fat survival. So, for example, smaller, finer cannulas remove a finer fat, which heals better, so the fat can quicker connect to blood supply. Concerning the filter systems for the fat tissue, it removes extra fluid, prepare the fat during harvesting so that there's no time lag. The fat can be injected directly and quickly without extra processing. Some other filter systems, they need even to do more processing, and it's time consuming, and the fat cells might be harmed during this process. Then, for example, we have the gentle harvesting is very important. So the fat should be removed carefully without too much force or energy, especially in the deep fat layers. So, and as I already said, but it's very important, that's why I want to say it again, that the time between harvest and ejection should be as short as possible. And we say it commonly in all terms of medicine, time is tissue. So
Okay.
all of these factors are very important because when you harvest larger or rougher fat clumps, the survival rate is less because the blood supply cannot reach all cells. And then you have the other complications like cysts, oil cysts, or calcification.
Okay. Well, that's a lot to know. So as I can see, patients have to do their research very carefully. Yeah. To get known to the experience of their surgeon and also to the technique he or she is using. Yeah. Okay.
Absolutely. When you watch on Instagram all the reels and the advertisement for lipofilling, and sometimes you see how surgeons perform the liposuction, it's not the way how it should be done, because it's this to harvest fat which can survive and can be re-injected is a very specialized procedure, and it needs a lot of experience and technique in order to have the best tissue. And and that's why it's very difficult for the patient to understand. And how is the difference between just a normal liposuction?
Okay. Okay. So, what about contraindications? Are there any contraindications for lipofilling as well?
I think there are some situations where we must be careful. So this is after mastectomy with or without implants, because in this patient the skin is very thin and tight, and it's often difficult to achieve good fat survival rates because there is no space in the tissues. This is too thin usually. Multiple procedures might be needed, and we did that, but the results are sometimes very limited. And of course, when you perform it with implants, there's also the risk of implant damage if the patients carry an implant, and the risk of infection due to the thin skin is also possible. So, secondarily, when we have a very thin woman with little tissue, the results can still be good depending on skin quality and thickness. But as I mentioned, all the factors before, you need to decide before the surgery if there would be a good result or not. And there are some patients who take immunosuppressive medications, and here you need a special precautions because wound can heal more slowly and infection risk is higher. So antibiotic management and strict hygiene standards are essential. For example, we are using plastic cannulas to cover, and we are cleaning the instruments with alcohol between each time of use in order to reduce risks. But performing liposuction is very different in each kind of operation room. So one risk there that is just to mention and to show that this is not a procedure which is taken so easy. That is a very rare complication for concerning internal infections and affecting deeper tissue layers. And this is a serious infection and can even be life-threatening.
Okay.
But it's very, very rare, and we have antibiotic standards, and I think more or less, I hope that all the surgeons have a high standards in hygienic.
Yeah. Okay, Dr. Kolios. Hopefully, I haven't forgotten anything. And is there anything you would like to add, or?
I think we summarized it very widely and also very specialized. But I think if there are other questions we didn't mention, I think the people could ask us, and we will answer them during our accounts. This is of course possible. I
Okay.
think coming to a conclusion, I think it's again it's a very specialized procedure, and small differences can lead to very different results and to very different complications. And I think that's why maybe in the internet there's talking so much about the results.
Okay. Yeah, and if someone will wonder why we talk about that topic, we as non-profit organization, for us, it's we often see women who had their implants removed and who are quite unhappy with the aesthetic result, or not even with the result, but also with the own outcome or feeling. I don't know how to explain it. And we all know that they go to see a plastic surgeon and to have lipofilling sooner or later. So that's why we
Yeah.
decided to talk about it. Yeah. Okay. So thank you so much for your time again and valuable insights. We hope our listeners found this episode helpful and could take away important information. As always, if you need support, you can reach out to our nonprofit organization, Krank durch Brustimplantate, wir helfen e.V., or of course to Dr. Kolios if it's
Of course,
about
of course,
lipofilling.
of
Okay,
course.
yeah. So
Thank you so much.
thanks to you. Thank you for listening, and take good care of yourselves. Bye-bye.
Bye bye, bye bye.
Bye.